we will go for the last hypersensitivity reaction, that is the type 4 hypersensitivity reaction or the delayed hypersensitivity reaction. This is also one of the frequently asked questions. Okay, so it is mediated, it is a cell mediated. We have seen type 1, 2, 3 are antibody mediated, while here this is the cell mediated or T cell mediated. It is delayed 48 to 72 hours. Mediator here is a TDTH cell, also called as TH1 cells. Okay, so T delayed type hypersensitivity cells, also written as a TH1 type effector T cells. Okay, there are two phases. The first phase is a sensitization phase, and second phase is the effector phase. What happens in the sensitization phase, which happens over a period of 1 to 2 weeks? There are antigen producing cells. These antigen processing cells, will process and produce the antigen via MSC2 to the CD4 T cells. Okay, then CD4 T cells will further differentiate into TH1 type of cells. Okay, here the TH1 type of cells are responsible. Okay, then second phase is the effector phase. When there is a re-exposure, there is a stimulation of these T helper cells. These TDTH will get activated, and then they will cause cytokine release, and the macrophage will be recruited. Okay, so what are the key cytokines here? It is interferon gamma, interleukin 2, TNF beta, MCAF, that is monocyte chemotactic and activating factor, MIF, that is macrophage migration inhibitory factor, and GM-CSF, that is granulocyte macrophage colony stimulating factor, out of which interferon gamma, that you should remember, that activates macrophages. Type 4 hypersensitivity reaction, these macrophages are very important, and the cytokine is interferon gamma. Okay, the IL-2 is responsible for T cell proliferation. TNF beta is responsible for inflammation. MCAF, that is monocyte chemotactic and activating factor, is responsible for monocyte recruitment. This macrophage migration inhibitory factor is retaining the macrophage. Here these macrophages are important. Okay, and this is mainly via interferon gamma. Then you have granulocyte macrophage colony stimulating factor, monocyte production. Granulocyte, monocyte, actually from monocyte only you get macrophages. Okay, colony stimulating factor. Okay, so interferon gamma is the key cytokine in the type 4 type of hypersensitivity reaction. So what is the mechanism of damage? So once these macrophages are activated, they will produce reactive oxidative stress, nitrous oxide, and various enzymes, and that will lead to the tissue destruction. So what is the role of type 4 hypersensitivity? It may be protective because it kills the intracellular organism like tuberculosis. It may be pathological. Excess macrophage activity will lead to the tissue damage. Okay. So just to recapitulate, it is a cell-mediated T cell response. It is delayed 48 to 72 hours. Mediator is a TDTH or mainly TH1 derived TH1 helper cells. Effector is a activated macrophages. Okay. What are the examples of delayed hypersensitivity? Bacteria like Mycobacterium tuberculosis, Mycobacterium leprae, Listeria, Brucella, etc. Fungi like Pneumocystis jirovecii, then Candida, Histoplasma, Cryptococcus, viruses like herpes simplex, variola, measles, etc. Various skin tests such as tuberculin test for tuberculosis, lepromin test for leprosy, Montenegro test for leishmaniasis, freeze test for LGV. These are also type 4 type of hypersensitivity reaction. Then contact dermatitis. Contact dermatitis, common antigens are nickel, poison ivy, then poison oak, picryl chloride. These are contact dermatitis is also type 4 type of hypersensitivity reaction. Here the mechanism is important. Here what is there? Most of these are haptens. These haptens will join with the skin protein. They will form immunogenic complex, and these antigen producing antigen processing cells or the Langerhans cells will cause T cell activation. Then there is a TDTH response, and then further there will be macrophage mediated damage. Clinically, there will be erythema, itching, vesicle, pustule, etc. What are the other examples of type 4? It is a non-infectious conditions like type 1 diabetes mellitus, multiple sclerosis, Hashimoto's thyroiditis, Crohn's disease, chronic transplant rejection, graft versus host reaction. So remember, these non-infectious conditions you get in type 4 type of hypersensitivity. Specific reaction is a lepra reaction type 1. Okay. And one of the typical feature of this type 4 hypersensitivity reaction is a granuloma formation. It is seen in chronic DTH response. It is an organized macrophage response. Okay. So what happens here? There is a persistent antigen. So antigen is persistently there. So there is a continuous T cell activation. There is a more macrophage recruitment. These macrophage will get further differentiated into epithelioid cells. They will fuse and will form the multinucleated giant cell. So what is the structure of granuloma? You see inner core of epithelioid cells surrounded by lymphocytes, surrounded by outer fibroblasts and the connective tissue. Example is tuberculosis, leprosy, sarcoidosis, schistosomiasis, etc. Okay. Then there is a tuberculin test. This is a principle is it is a prototype of type 4 hypersensitivity reaction. There is a prior sensitization that leads to the TDTH cells present. So TH1 type of helper cells are present. Then there is an intradermal tuberculin when you give that causes reaction in 48 to 72 hours. So induration is more important and not the erythema. It is surrounded by the erythema. Okay. So let us see in summary. Type 4 hypersensitivity reaction is a cell mediated. Mediator is a TDTH cell, that is TH1 cells. Then cytokine is a interferon gamma. Effector cell is a macrophage. Time gap is generally 48 to 72 hours. Examples are TB test, contact dermatitis, and granule. And now we will have the recapitulation of all four type 1, 2, 3, 4. IgE is seen in type 1 hypersensitivity. Induration is a positive test, not the redness in type 4. Then immediate response, not always type 1. It could be type 2, type 3 because only delayed is a type 4. Okay. But type 1, type 2, and type 3 all will have immediate response. But most common is a type 1. Okay. Then anaphylaxis drug of choice is a histamine. Wheel and flare is because of the histamine. TH2 will stimulate, will lead to the interleukin 4, and that will lead to the production of IgE. Delayed hypersensitivity after 48 hours is a type 4 type of hypersensitivity. Immune complex is seen in the type 3 type of hypersensitivity. Type 2 is a cell destruction via IgG or IgM. Type 3 is a immune complex deposition. Type 4 is a delayed T cell mediated. C3b is responsible for opsonization. C3a, C5a for inflammation. Interferon gamma for macrophage activation. Arthros is a localized type 3 reaction. Arthros is localized type 3. Serum sickness is systemic type 3. Okay. So arthros is a localized type 3, while serum sickness is a systemic type 3. It will take 7 to 8 days. Okay. So that finishes the hypersensitivity reactions. We have certain SBS, Doctor. Dr. Sansi, you want to read these questions?
Yes. Yes, sir.
Yes.
A 24-year-old woman develops urticaria and hypertension within minutes of receiving IV penicillin. Which mediator is primarily responsible for the acute vascular changes? Sir, option B, histamine.
Yes, type 1 here it is responsible. It is a histamine, type 1 hypersensitivity, mast cell degranulation, histamine release, and causes vasodilation and increased vascular permeability leading to hypertension. Next.
A patient develops hemolysis following mismatched blood transfusion. Which mechanism is mostly responsible? Ig mediated mast cell degranulation, immune complex deposition, complement mediated cytolysis, T cell mediated cytotoxicity, T cell mediated cytotoxicity, delayed macrophage activation. Sir, hemolysis will be type 2. It will be complement mediated cytolysis.
Yes, here it should be complement mediated cytolysis. Okay, complement mediated cytolysis, type 2 hypersensitivity reaction, IgG, IgM activates complement. C5 to C9 are MAC. Okay, that causes RBC lysis. Okay, next.
A 30-year-old woman with autoimmune hyperthyroidism has antibodies stimulating TSH receptors. This represents type 1 hypersensitivity, type 2 cytotoxic hypersensitivity, type 2 cellular dysfunction hypersensitivity, type 3 hypersensitivity, or type 4 hypersensitivity. So, type 2 autoimmune, autoimmune hypertension has antibodies. So, type 2 cellular dysfunction hypersensitivity. Great, go.
It is type 2 cellular dysfunction. Okay,
Yes.
hypersensitivity. Okay, so type 4. Oh, sorry, type 2 cellular dysfunction. In Graves' disease, you have antibodies stimulate receptor, that is LATS type of antibodies. There is no cell destruction, functional alteration through ADCD. Okay, next.
A farmer develops
Uh,
breathlessness after exposure to moldy hay. Investigation suggests immune complex deposition in lungs, which is the underlying mechanism. Ig-mediated mast cell degranulation, complement activation by immune complexes, T-cell mediated cytotoxicity, antibody-dependent cellular toxicity, direct toxin-mediated injury. So, complement activation by immune complexes. Option B, type 4.
it is a type
Hypersensitivity.
4. Option B, complement activation by immune complexes.
Type
Farmer's lung is a type 3 type of hypersensitivity. There are immune complexes and activate complement leading to inflammation and lung injury. It is a type 3 type of hypersensitivity.
3.
Okay,
Which of the
next.
following best explains the tissue damage in type 3 hypersensitivity? Direct antibody mediated cell lysis, no mast cell degranulation, no frustrated phagocytosis by neutrophils, cytotoxic T cell apoptosis, new NK cell activation. So frustrated phagocytosis by neutrophils.
Correct. Normally also there is a clearance of immune complexes via RBC shuttle. But here what happens? This phagocytosis neutrophils get frustrated. Okay.
Mm-hmm.
So frustrated phagocytosis by neutrophils. Neutrophils cannot engulf large immune complexes and release enzyme leading to tissue damage. Next.
A Montauk's test shows induration after 72 hours. Which cytokine is most critical in this reaction? Interleukin 4, interleukin 5, interleukin gamma, interleukin 10, or histamine? It is
Type
interleukin
4.
4, type 4, interleukin 4, sir. 4
Is
and
it?
5.
It is interferon gamma. Type 4,
Interferon
interferon
gamma.
gamma. Okay, type 4. This was the last concluding take home message we
Right.
discussed. Type 4 hypersensitivity, interferon gamma activates macrophages responsible for induration. Next.
A patient develops contact dermatitis after wearing nickel jewelry. What is the key initiating event? IgE binding to mast cells, immune complex formation, hapten binding to skin proteins, complement activation, NK cell mediated lysis. So it is option C, hapten binding to skin proteins.
Yes, that is the first phase. Okay,
First.
the hapten will bind to the skin proteins, then it will produce the immunogenic response. Okay.
Yes.
Okay,
Yes.
and then this will be followed by the second phase. Okay, effector phase is that hapten binding to skin proteins. That is nickel is a hapten. Hapten plus protein will lead to immunogenic complex that will lead to T cell activation and that will lead to the DTH. Next.
Which of the following conditions is mediated by antibody-dependent cellular toxicity? Asthma, rheumatoid arthritis, tumor cell killing by NK cells, tuberculin reaction, serum sickness. There are rheumatoid arthritis.
ADCC. ADCC.
ADCC.
Which of the following conditions is mediated by ADCC? Tumor cell killing by NK cells.
NK cells.
ADCC is immunoglobulin plus FC receptors on the NK cells. This is used for large targets, tumor, parasites, etc. Okay,
Yes, sir. A
next.
patient a patient develops fever, rash, and arthralgia 8 days after receiving anti-serum therapy. What is the most likely diagnosis? Sir, option B, serum sickness.
Yes, here and typical it is 8 days after, no, but fever,
Yes.
rash, arthralgia is there after receiving anti-serum therapy. What is the most likely diagnosis?
Delayed hyper-
It is serum
Serum
or
sick-
delayed? It is
serum
serum
sickness.
sickness. It is type 3 hypersensitivity reaction. It occurs 7 to 10 days after exposure. This has been asked. Fever, rash, arthralgia. Okay, next.
Which of the following combinations is correct regarding hypersensitivity reactions? Which of the following combination is correct regarding hypersensitivity reaction? Type 1 IgG delayed no, type 2 immune complex immediate no, type 3 IgE immediate no, type 4 T cell mediated delayed yes, type 2 IgE cytotoxic no. So option D, type 4 T cell mediated delayed.
Yes, type 4 is a T cell mediated delayed hypersensitivity reaction. Okay. Then type 4 is a cell mediated, delayed 48 to 72 hours. All other options are not matching. So classically this can be asked. Okay. So from examination point of view, you remember histamine is seen in type 1 hypersensitivity reaction. Then MAC, okay, that is C5 to C9 is type 2 type of hypersensitivity reaction that is causing cell destruction. Then frustrated phagocytosis in type 3. INF4 interferon gamma is in type 4. Okay, 7 to 10 days seen in serum sickness. Hapten is seen in chronic dermatitis. There are still more few questions. Doctor, you can read it.
A patient develops bronchospasm within minutes of allergen exposure. Which biochemical mediator is most responsible for sustained bronchoconstriction? Histamine, prostaglandin E2, leukotrienes, bradykinin, interleukin 2. The long-acting was sustained, most responsible. So prostaglandin.
It's leukotrienes, LTC4, LTD4, LTE4. Leukotrienes are slow reacting substance of anaphylaxis, SRSA. Okay, cause
Hmm.
prolonged bronchoconstriction, more potent than histamine. Okay,
Yes. During
next.
sensitization in type 1 hypersensitivity, which cytokine is primarily responsible for class switching to IgE? Interleukin 2, interleukin 4, interferon gamma, interleukin 10, or tumor necrosis factor 4. So, interleukin 4,
Class switching to IgE.
IgE.
So interleukin 4. Th2 cells will lead to interleukin 4 that will lead to B cells to produce IgE. Okay, via it is interleukin 4. So central step in allergy development is via interleukin 4. Okay, next.
Which complement component is directly responsible for opsonization in type 2 hypersensitivity? Sir, option C, C3b.
Opsonization is C3b. Chemotaxis is C3a and C5a.
And C5.
Okay.
Yes, sir.
Yes, C3b is opsonization. So C3b is a major opsonin, facilitates phagocytosis via complement receptors. Next question.
A patient develops acute hemolysis due to drug adsorption on RBCs, acute hemolysis. Which mechanism is most likely? Ig mediated mast cell activation, immune complex deposition, complement mediated cytotoxicity, T cell mediated cytotoxicity, delayed macrophage activation. Sir, option C, complement mediated cytotoxicity.
Absorption of the
Acute hemolysis.
RBCs, drug
Acute
absorption.
hemolysis.
Which mechanism is most likely? Is complement mediated cytotoxic toxicity. Drug acts as antigen on RBCs. IgG binds, leading to complement activation and leading to cell lysis. Cell destruction is that it is a type 2 type of hypersensitivity. Next.
Which of the following best explains frustrated phagocytosis in type 3 hypersensitivity? Neutrophil fails to recognize antigen. Immune complexes are too small. Immune complexes are too large to be ingested. Complement is not activated. Macrophages are absent. Sir, option C, immune complexes are too large to be ingested.
Yes, immune complexes are too large to be ingested. Okay. So large complexes cannot be engulfed. Neutrophils release enzymes that lead to the tissue damage. Next.
Which of the following cytokines is most important for macrophage activation in delayed hypersensitivity? Which of the following cytokines is most important for macrophage activation in delayed hypersensitivity? Interleukin 5, interleukin 4, interferon gamma, interleukin 1, or interleukin 6? So, interferon gamma.
Correct. So it is interferon gamma. That is the key cytokine in type 4 type of hypersensitivity. It enhances macrophage killing. Okay, next.
A patient with myasthenia gravis has antibodies against acetylcholine receptors. This represents myasthenia gravis has antibodies against acetylcholine receptors. This represents complement-mediated cytotoxicity, immune complex deposition, antibody-dependent cellular toxicity, antibody-mediated receptor dysfunction, T cell mediated destruction, antibody mediated receptor dysfunctions are
Yes,
option.
it is antibody mediated receptor dysfunction. Okay, so sometimes there is activation, sometimes there is a blockage also. So
Blockage.
answer is D, antibody mediated receptor dysfunction, type 2 variant. ADCD is there, antibody blocks receptor function. Next.
Which of the following best explains systemic manifestation in serum sickness? IgE mediated mast cell degranulation, immune complex deposition in multiple tissues, direct cytotoxic T cell injury, NK cell mediated lysis, complement deficiency. So, immune complex deposition in multiple tissues.
Serum sickness, immune complex deposition in multiple tissues. It is a type 3 type of reaction. Small soluble complexes will lead to the systemic deposition. Next.
Which of the following is responsible for chemotaxis in neutrophils in hypersensitivity reaction? Sir, option B, C5.
Correct. C3 and C5 will be chemotactic in nature. Okay. It is
Yes.
C3A or C5A. That is C5A is only here. C5A is a potent chemotactic factor. Also acts as an anaphylotoxin. Next.
A patient develops induration 48 hours after tuberculin injection. Which cell type is primarily responsible for this reaction? B lymphocytes, plasma cells, mast cells, TDTH cells, neutrophils. Sir, option D, TDTH cells.
Yes, TDTS
TH1.
cells. Yeah, TDTS cell type 4 type of hypersensitivity. TDTH, that is TH1 derived cells, will lead to the cytokine release, leading to macrophage activation. Next.
Which biochemical mediator is responsible for immediate increase in vascular permeability in type 1 hypersensitivity? Sir, option A, histamine. Histamine is the answer, sir.
Yes, type 1 histamine. Okay. Early phase mediator causes vasodilatation, permeability, leading to wave. Next.
Granuloma formation in tuberculosis is primarily due to IgE-mediated mast cells activation or immune complex deposition, complement-mediated lysis, chronic T-cell mediated macrophage activation, NK cell cytotoxicity. Sir, option D, chronic T-cell mediated macrophage
Yes.
activation.
Chronic T cell mediated macrophage activation. So persistent antigen will lead to the continuous DTH stimulation, leading to the macrophage activation, leading to the granuloma formation. So final take home message: interleukin 4 will lead to the IgE switching. Okay, that is in type 1. Then leukotrienes will lead to the prolonged bronchospasm. C3b is responsible for opsonization, C5a for chemotaxis, interferon gamma for macrophage activation, frustrated phagocytosis is seen in type 3 damage, ADCD is the receptor dysfunction seen in Graves or myasthenia gravis, and granuloma formation is seen in chronic type 4 type of hypersensitivity. Okay, so that finishes today's topic and the whole module of immunology. Thank you.